Hey guys, me again doing another Lyme update. I literally just had oral surgery, so if I'm talking a little funny or anything, then that's why. I wanted to get this done so I could capture my emotions right after and while I'm still numb, because I'm sure this is going to wear off soon and I might be a little bit of pain. I went to Clearwater Family Dental, so that's about an hour drive for me. Got up really early to go. Honestly, I almost didn't go. I started freaking out. I'm like, oh, you know, you get stuck in this conspiracy theory of, oh, our root canal is really bad for you, or we shouldn't go pulling out our teeth. And although there's a lot of evidence showing that it could be harmful to your health, especially if you have chronic disease. So I was going back and forth, and I'm like, I really don't want to lose my teeth, but I decided to get up and go anyways and talk to the dentist and just get the scan, see what he said. And I'm super glad that I did. We did the full head scan, and everything looks great except for the one root canal. I had 4 root canals on the same tooth, and the roots went up into my sinus cavity, and the ligaments around there were getting split apart, and he could tell that there's cloudiness and possible infection there. So I decided to go ahead and remove it just because I'd had so much problems. And he's like, listen, you know, this one tooth is directly connected to thyroid issues and everything. It's this top back right one is connected to your thyroid, and we all know I've had major thyroid issues, and my other Lyme doctor had said the same thing. So, and the guy's like, look, I'm about full health, and this is just one tooth. If it was my wife, I'd, you know, probably not tell her to pull if she didn't have Lyme disease, but you have Lyme disease and multiple issues. He's like, I recommend that you pull it, but that's up to you. This is your mouth, your health. I just want you well. This is just a tooth. So I'm like, all right. So I decided to go ahead and do it. And he does PRF, which is a platelet-rich fibrin, I think it is. Basically what they do is they take your blood and then they spin it, and it separates it so that your stem cells and your platelets and proteins and all the good hormones and everything gel out into this yellow stuff, this yellow snot-looking thing, and then the rest of your blood. And so they will, you know, put that up in there it'll heal it like twice as fast. It's your own stuff. It's your own body healing itself. And it's, instead of, you know, pulling the tooth out and then the gums grow over and then there's all this bacteria in this pocket, it can bring the bone back to where it needs to be in case I ever wanted an implant or anything like that. So I decided to do that. Praise God, like, everything was covered by insurance except for the PRF, and that was $288. I left there with $288 I had to spend. Like, that's unheard of. That's amazing. I was expecting to pay way more, so praise God for insurance. I had 2 dental insurances, knowing I was going to have a lot of dental stuff this year. I didn't know this, but it's really helped my out-of-pocket. So they pulled the tooth, and that was not cool, just because you can hear the cracking and the but really cool. He like teaches all these foreign students from like Bolivia and some other cool places, some ladies from Germany, and so there's like 4 or 5 people in there learning state-of-the-art treatments. So that was pretty cool. I got to talk to a lot of cool people. They finally got the tooth out, and like I've been so emotional about it because I was so on the fence. If you have any kind of chronic disease or illness or anything and you have root canals, please go see a biological dentist. He pulled it out, and like, there was so much infection. And it was right up into my sinus cavity, and it's been poisoning my body for years. And the root canals that I had done on that tooth had the stuff that they fill it with went through the roots and were poking out the roots and poisoning my body. Like, I'm so glad I did it. I'm so glad I did it. He cleaned out all the infection, And he's like, it was even worse once we got in there than it looked on the scan. And I had no idea. I had no idea, because you just think, you go to the dentist, a normal dentist, and you're like, sure, I have a problem with my tooth, I get a root canal, you go on with your life. I had no pain in that tooth. Nothing to show that there was an issue. And it took, you know, these different scans to show a little bit, but then getting in there and taking it out, like, I've literally been sick for years because of this. So I'm so glad. I'm just so glad I did it. Like, praise God for leading me to the right people. And I know it's probably not going to be very comfortable later, but that's okay. I mean, I've been mentally prepared for the whole process, but I guess I wasn't prepared to have physical evidence that, hey, root canals can ruin your health. They can ruin your health. And I mean, it's a dead tissue in your body. Just, it's a dead vessel in there. And if you have Lyme disease, then Lyme spirochetes love to hang out in there. So definitely check that out. Please check that out. If you have any kind of health issues and you have root canals, please check that out. Also I have 2 mercury fillings from like 20 years ago. He's like, wow, whoever did that was really awesome at it. And I think I had the Air Force. I was on an Air Force base somewhere. So he's like, they did a really good job, but those need to come out. So I only have 2 of those. So in a couple weeks, I'll go back and have those taken care of. And those are going to be covered by insurance. So praise God for that. Like, literally, I got through all of this stuff with just $288. Like, that blows my mind. So blessed with that. He said the rest of my teeth look great. He's like, they look great. I have some staining going on. And he's like, what's going off the staining? Are you drinking coffee and tea? I'm like, I don't drink any of that stuff. I drink water. And the problem is I'm taking so many herbs for the Lyme that they're staining my teeth. He's like, don't even worry about it. We'll fix that later. That's just cosmetic. You keep taking your herbs, you're fine. So they were absolutely amazing team of people. So glad that I did it. Right now I feel fine. I don't think I have too much swelling right now, but I mean, literally it was just like 30 minutes ago. And the cool thing about it was I got to look at this. I don't know. I'm on the water. If you're going to go and have oral surgery, have it on the water. It's beautiful. It's beautiful. So anyways, I just wanted to share that. Blessings. I really feel like I'm on my way to full body healing now, and I'm totally glad I did this step. Like, if you've been, you know, worried about it or anything like that, please research it and just go get an evaluation. You don't have to do anything, but have someone look at you. Like, this is so worth it. You could have infection in your body right now and not even know it. Anyways, love you guys. Bye.